Okay, so I'm a little bit late in filming this video, but I just wanted to give you an update on what's going on and how I'm navigating the healthcare system here in Merida. So if you're new to the channel, I've been having bilateral hip pain in both hips that's been going on and getting worse for the past few months. And I know there's a problem, but I just wanted to finally address it. I'm a physical therapist and I haven't been a good patient, admittedly, but I wanted to finally kind of have a doctor look at it and see what's going on. So in my last video, I documented how I was able to schedule an appointment with a medical clinic to go in and get my hips x-rayed. It's really nice because I can do this all as a patient. I don't need to go see a doctor to prescribe the imaging. And in my last video, I showed how I went through and did that visit. About 4 hours after I got my x-rays done, they had emailed me images of the x-rays themselves along with a results sheet. So now the next step was to take these images into the physician, have him look at it, and just have a discussion about kind of what he thinks about my hips and what we should do going forward. I wasn't able to go back to the clinic until a few days after the appointment, and so I actually got the films, and you probably won't be able to see them here, but I wanted to get these. I wanted to get these so I could take them to the physician and have him take a look at it. So making an appointment with the physician was super easy. I just texted on WhatsApp, and 2 days later I had an appointment. Now here in Merida, there's a lot of different public and private hospitals. So I opted to go to Hospital Faro, which is kind of really on the northern side of the city, kind of where there's a lot of new developments, and so it's the newest hospital. It's state of the art. It's clean. You're going to pay more at one of these newer hospitals, but I just thought for kind of the convenience and comfort for me, I wanted to just go ahead and get my appointment done at Faro. So 2 days after I made the appointment, I was able to just show up. You can see here that all of the facilities are super clean, super modern. I don't tend to like to film a lot in these hospitals or medical facilities. I think it's just an old remnant of me being a clinician and trying to observe HIPAA policies that I don't want to film other patients. I feel very uncomfortable about that. I probably should have taken more videos, but just trust me that this is state of the art. Everything looks really good. Everything is clean, and my appointment with my doctor, walked right in, signed in. I was right there into his office to have a discussion with him. So there's no nurses, there's no intake here, at least in my experience. You just walk right in, sit down at the doctor's desk, and you can just start to discuss. So regarding my hips, I gave my kind of a brief history of what was going on, what I was experiencing, and then pulled out my images, the x-rays, and he goes immediately, he didn't even need to put it up in the light box. He goes, oh yeah, I see what's going on. So very straightforward what's going on here. Let me go ahead and show you now on the computer exactly what's going on with my hips. So here it is. Here is the x-ray of both of my hips. See the right side, obviously, over here, left side over here. So the first thing that the doctor looks at is the joint space. So we're looking to see, as you can see here on the right side, how much space there is between the head of the femur. You can see the big bulbous part there as it articulates into the acetabulum, which is kind of the female part of the joint there. And what you want to see is a lot of kind of black space between those two bones. There's not a lot of black space here. So you can see that, particularly right down through here, we're really talking about kind of bone on bone. And when we look over the left side, you can see kind of the same thing here. Not a lot of clean joint space here. Now, let me just back up really quick and say, from a physical therapist perspective, do not rely on imaging to really diagnose or make a treatment plan. So what I mean is a lot of people will have really horrible looking X-rays or MRIs, but maybe completely asymptomatic. So for instance, anyone who's like in their 60s, if you get a scan of your spine, you're going to show, because you're human and you've been on the planet for decades, you're going to show some signs of degeneration, whether you're feeling it or not. So the dangerous thing that I have found in the past as a clinician is people will come in who maybe weren't feeling that bad, but then they get this nasty looking X-ray or MRI and go, oh my God, now I'm really hurting, because it's kind of this mental loop where you see it and then you just kind of freak out, and all of a sudden your brain kind of kicks in and you start feeling worse. It's kind of this psychosomatic loop. So just be careful that if you do have imaging, just listen to your body. That's way more important than anything that X-rays show. And that was a little bit of my hesitation to get an X-ray in the first place, is because I didn't want to foster kind of that psychological loop, because I knew these scans were not going to look very good. So first thing we're looking at here is joint space. It sucks. There's not much joint space here, which I was frankly pretty aware of. Now, the other thing that we're looking at here, down here, is you're seeing these are, points where there's really no joint space, and that's where we're getting a lot of pain. So a lot of pain that I'm having is anterior or in front of the hip and inferior. So anytime that this bone, these hips kind of move in or up, so if I'm flexing my hip up in the air, I'm getting a pinch point right there. So this is likely the spot that's really causing a lot of the pain that I'm having when moving. So doesn't look real good there. Now here's the real cause of it, and I'm an idiot because I knew this years and years ago and I didn't do anything about it. But what we have here is an abnormal bony structure of my hips. So it's called here, it's called a cam lesion. Now what that means is there's two different kinds of bony deformities that you can have at birth that aren't uncommon, by the way. One is called a cam lesion and one is called the pincher lesion. Cam lesions tend to be more frequent in boys, pinchers more frequent in girls. And you can actually have both if you're that lucky. So what this means is there's just a little extra bone growth here and here on both sides. It shouldn't be kind of that bulbous, if you will. I think I have, here's normal. Here's what normal looks like. You can see how it kind of indents this way and comes back around, and mine just goes right out like that. Okay? So the problem with that then is that when you're moving, and particularly if you're active like I always was and did a lot of running, a lot of biking, tennis, baseball, you name it, I did it. So every time that the hip is moving, what it's doing with this extra kind of bony structure here is it's compressing on, there's a capsule that surrounds this entire joint. So it was getting impingement syndrome, or FAI, femoral acetabular impingement, meaning we were getting some pinching on that capsule. Now, that capsule can actually break off too, which I may or may not have had in the past. I don't know. But one way to know if you're having this, if you're considering that you might be having FAI or femoral acetabular impingement, if you just roll your knee in and bring it across your body, and if you're getting a pinching symptom kind of in the front of your hip, the anterior and kind of in your groin area, you might have FAI. So what I should have done is address this years ago, back when I was in Los Angeles. What I could have done is just gone in, got some arthroscopic surgery, which is just kind of shaving down some of that bone so that it can move easier and in a normal way. But I didn't, because I'm an idiot. So now we're stuck with kind of osteoarthritis, kind of very advanced osteoarthritis here in both of my hips. So now the question becomes, what am I going to do about it at this point? Now I'll let you know the conversation I had with my doctor. After reviewing my x-rays, the doctor basically confirmed that I am a candidate for total hip replacement on both hips, which isn't really too much of a surprise for me. I had a conversation with him to kind of figure out, okay, what does hip surgery look like in Mexico? I'm very familiar. I've had hundreds of patients that I've helped rehab after hip surgery. So I've seen a hip surgery in person in the operating room. So I'm quite familiar with it. Now in the US, it's very common. It's relatively new. When I say relatively new, it's probably 15 years old now. The new technique for total hip replacements is they go with an anterior approach, meaning they make the incision in front of the hip and go in and do all their carpentry there and replace the hip. They don't do that here. They still are doing kind of a posterior lateral approach, which means they make the incision back here. And the problem with that is that you're cutting through a lot of muscle. When you go anteriorly, you're sparing all that muscle. So it just makes the rehab process so much easier when you don't have to wait for these muscles to heal up and there's pain and there's a bigger scar, bigger incision on the posterior lateral approach. So that's one concern that I have. Now, in talking to the orthopedist here, it's not that they're less skilled at all. He hasn't been trained for it. He said he could very easily go and train. The technique isn't that difficult to do, he says. But the problem here in Mexico is they don't have the operating tables. I guess the tables need to be a little bit different with an anterior approach. And the hospitals just aren't equipped with those tables to perform that surgery. So that's a little bit of a concern for me. We talked about the prosthetic that goes in. It's very similar to everything that I'm used to in the States. In fact, there's a new prosthesis that I wasn't aware of that actually provides a little more mobility than the old ones, which I fully intend that if and when I do have my surgery to remain active. So I am going to want one that remains very mobile for me. So basically what we decided to do is just kind of wait and see. You know, kind of the old adage is you'll know when it's time to have a hip surgery. And I just don't feel like I'm there yet. I'm my early 50s, and so who knows how long these things last. 15, 20 years was kind of the old timeline. So I don't know, because again, I'm going to be active. I want to push this off as long as I can, as long as the pain isn't inhibiting my day-to-day functioning. And right now it's been pretty good. There is an option. He can go in and do some injections into the hip. He has the ability to do that as well. We might consider that if it gets too bad. The other thing that's different in Mexico is he likes to keep patients overnight after a surgery, whereas in the States it's become much more routine in very uncomplicated cases where the patient goes home the very same day. The patient is up and walking almost immediately after surgery, and they're just a little more conservative here. And again, part of that is because of the surgical approach that they're doing. Bottom line is that this orthopedist I was very comfortable with. I might use him if I decide to have surgery, but what we decided to do right now is he's prescribed me some anti-inflammatories and some pain pills if the pain gets really bad, non-opioid pain pills, by the way. So here's the cost in Mexico to see a doctor like this. It was about a 40-minute discussion in his office, one-on-one with him, discussing all the options, discussing surgery and everything. It cost me 1,100 pesos, which at the time is about 56, 57 US dollars. The pain meds, he gave me Celebrex, a bottle of 30 of those. And the pain meds, I don't even know how many in a bottle because I haven't had to use it yet. And both of those combined as well were also 1,100 pesos. So 56, 57 US dollars for that. And now we're just going to kind of wait and see. I've been taking a Celebrex pill once every 3 days or so. On the off days that I'm not taking a Celebrex, I'm taking an ibuprofen, and my hips are feeling really good. I'm back to walking 10,000 steps. There's been no exacerbations. Occasionally, if I'm walking on the beach and I twist or turn a little bit wrong, I'll get a little bit of a pinch, but by and large, it's feeling really good so far. So the moral of this story is the health care. So the moral of this story is that the healthcare system, at least the private healthcare system here in Mexico, is really state of the art. It's inexpensive. It's very accessible. You can get appointments with pretty much whenever you like. It's very affordable, and for uncomplicated things like hip osteoarthritis, it might be a really good option to consider. In a future video, I might go over how the health insurance works here, because that's a whole other animal, and I haven't really had to use it yet. But if you're interested in how the insurance works, drop me a comment below, and I'll be more than happy to schedule to shoot a video on that. So take care, everybody, and I wish you all the best of health.